to chair this session, we have Dr. Satish. I would request him to come over to the podium. He's a lead psychologist of Manipal Hospitals, good friend of mine. We have done a lot of work, learned a bit of mind from him. And in the COVID pandemic, he has done a great deal of work to the nursing staff, paramedics, and to many of the doctors like me, and helped us publishing one of the largest study about mental health assessment in the COVID times. Please take seat, and I would also request Dr. Hemant Bhargav to take center stage, and very important topic for all of us, I think, role of mind-body medicine, including yoga in managing type 2 diabetes.
I am Dr. Hemant Bhargav. I am MBBS. When we see patients of T2DM, who have to take medicines for a long time, and then when they take medicine, patients come to us. I was doing it from Government Medical College in Nagpur. So there used to be huge queue of the patients in the morning in the OPDs. And then, I used to wonder how 200, 300 patients we are going to see in the medicine OPD. But then as an intern, my work was to just write continue same, because the medicines were available for free and there used to be huge queue. So then, in between patients would ask, sir, I'm taking this medicine, what next? So this was the question in my mind. We all know that lifestyle is very important, but then incorporating that lifestyle is a challenge. So therefore, I decided that I'm going to explore deeper into the area of lifestyle, and therefore I did my MD in yoga and rehabilitation and PhD in yoga, and got interest into yoga research, and then conducted a couple of randomized controlled trials, one trial in diabetes 2, which has recently been concluded, so I would be sharing my results with you. So basically, my talk, this 20-minute talk, first 10 minutes, I would like to give you an orientation to mind-body medicine, especially to yoga, and then talk about the evidence base. So this is, the talk of the day. Illness was one thing, where medicine focused, but now everywhere people are talking about wellness. So patients come to us, they say that, doctor, you say that all my reports are normal. My HbA1c is in normal range, my sugar is in normal range, my thyroid functions are in normal range, but I don't feel good. Though my reports are normal, I don't feel positive, I don't feel enthusiastic in my work. So the quality of life matters a lot. So therefore, emphasis is there globally on the wellness domain now. So this mind-body medicine aspects, the uniqueness is that apart from helping in getting the patient back to the comfortable zone, it can further be delivered even to a healthy person to move towards positive health. So here, the lifestyle, we know that it consists of diet, exercise, habits, and the mind plays a very important role. We tell patients, all the consultants practice holistic medicine now. It is not that only, the people who are doing traditional medicine. Even in modern medicine, we see that a lot of advices are given about, regular exercise, going for a walk, and what kind of diet has to be taken. But then we see in our clinical practice that patients are not able to adhere to them. So why, say, a person has diabetes and he knows that I should avoid sugar, I should avoid fat, but then he is not able to control his sugar levels. So somewhere, everybody knows what is to be done, what is not to be done. But why is it then the compliance with the lifestyle change is lacking? So here, the mind plays a very important role. So the mind of the person, the emotions of the person in that state are not being, the person is not able to manage. So we see that there are demanding situations in life, there are external demanding situations, there are internal demanding situations, some goals that I set for myself, and some that come to me from the environment. And it is here, the psyche of the individual is constantly under pressure. The allostatic load keeps increasing. The hypothalamo-pituitary adrenal axis always, is upregulated, and you see the continuous release of cortisol that keeps releasing. The sympathetic nervous system keeps getting activated. And here, that psyche, that stress, which is the speed of the thoughts in the mind, over a period of time, starts affecting different domains of the life. Stress accelerates the aging process. Stress affects the immune responses. Stress creates an imbalance in the autonomic nervous system, and therefore it acts as a very important, contributor towards progression of the disease and lack of control, especially in diabetes over the sugar levels. Now, the mind-body medicine, it is a discipline which has recently gained more popularity. So the National Center for Complementary and Integrative Health, US, it defines it as a discipline that focuses on the relationship between the brain, mind, body, and behavior, and its relationship with health. The predominant components that are included under this domain involve yoga, tai chi, guided meditation, imageries, biofeedback, mindfulness. Basically, the concept is mind over the body. So how much of the disease component, is contributed by the effect of the mind over the body, and if I am somehow, able to manage my emotions, will this translate into the clinical improvement, in managing the sugar levels, in adherence to the medications, the modern medications also. So in that way, this particular domain works. Yoga is considered as a very popular and, emerging mind-body medicine discipline. If you see 2 decades back, yoga was not that popular, and if somebody would ask about yoga, it would be considered, as something which is very secretive, to be done by sages who are staying in Himalayas. But now, after 2015, when the first International Day of Yoga was celebrated, we saw that 194 countries, including Islamic countries, are celebrating yoga, removing those, religious component from it and taking it in a particularly very scientific, secular way. It has emerged as a science of the body, breath, and mind. And number of, researchers now, if you go to PubMed and just put yoga, you see 6,500 hits. And randomized control trials, 27 randomized control trials in diabetes itself. None of the trials shows that it is not effective or it does not have any kind of positive effect. So now, if we go back to the roots, now if we ask what is yoga, a figure that comes to our mind with imagination of yoga is some very lean, thin figure doing an advertisement in a television, Shilpa Shetty kind of a yoga. But now, if you look at the tradition, the fundamental goal for which yoga was designed was calming down the agitations of the mind. Now, is it not a major issue now? Is it not a major component, psychosomatic component in all the patients that you see? How many of our patients come with those non-specific complaints, for which we don't know what to do? So it is here the mind that is playing a very important role, and the sage Patanjali in 400 BC defines yoga chitta vritti nirodha, repeated patterns of thought which are charged with emotions, again and again repeating in my mind. Whether it is an interpersonal relationship-related conflict with the boss, my pressure related to work, or my own demanding situation on my own perfectionism in my work. So these repetitive patterns of thought, there is no salvation. And especially with the current situation where we are exposed to, the mobile phone, so many WhatsApp group, Instagram, Facebook, there is so much stimulation to the mind every minute that there is no calming down. We call it as Abhimanyu syndrome. We know how to go deep into an issue, intellectually dissect the issue, have deep debates, but emotionally, when it comes to emotion, we are stuck. We just don't know how to come out. So it is here that this particular, the wisdom that is available in our ancient literature. So this Katha Upanishad is a dialogue between Yama and Nachiketa, where a structure of the body, the system is given. The chariot, kind of a parable, where the 5 horses are the 5 sense organs, and then the reins are the mind, which is connected to each of the sense organ. And the buddhi, the intellect, is trying to control these horses through these reins. And then there is an observer. There is a witness, a sakshi sitting behind, looking at the whole scenario. Now, if you look at this whole system, in current scenario, the horses are going haywire. What governs our life? What governs the direction in our life? These are momentary sense pleasures. Whatever our senses draw, we move towards it. Now, you keep scrolling now. Earlier, in the newspaper in Times of India, if you go, the news would end, but now it continues. You can keep scrolling, related news keep coming. So we just keep getting drawn and drawn and drawn, and we don't know where to stop. Shut Clinic, NIMHANS has started Shut Clinic, where every week we are getting 4 or 5 students, young students, getting addicted to internet, mobile phone, gambling disorder throughout the day. So From morning to evening, the person just comes out to have food or tea and goes back again. He just do not want to interact with anybody. So this is the situation of the youngsters in the country. And now here something is required. Our whole education system is drawing us out. Everything is drawing us out. But is there something, is there something that is giving me an equipoise and telling me that I have to turn within as well? Because the consciousness has a domain that moves out, that is in the external world. Consciousness has the domain that projects in the mental world or thinks. And there is a third domain of consciousness which turns inwards when I go into deep sleep. Now that is also a very important aspect of my personality, because there I get recharged for my functions. It is here that I get control over my emotions. Otherwise, if everything keeps drawing me out, the vehicle will cross a certain threshold and accident is bound to happen. So here comes the science of yoga, which says, take a pause, come back to the present moment, and then turn inwards. So turning inwards is focusing on this Atman, this consciousness. Bhagavad Gita describes that the model in which this human body should function is the consciousness, which is the witness, the sakshi, has to be cultivated by active efforts. In Vipassana meditation and other meditations, they cultivate this kind of non-judgmental observership. And then that gives the freedom and power to the intellect to control the mind, and the mind controls the senses, and then the body is governed in a particular direction. So there are different schools of yoga. Now unfortunately, branding of yoga has made yoga also lose that essence. We see now power yoga, even beer yoga getting popular. So it is very important that the essence, what our sages told, is retained. So the whole essence of yoga is you turn within, you take a break. So there are schools of yoga that have come up. Some focus on the body related aspects, some focus on the breathing related aspects, some exclusively focus on the mind, others use all of them together. But the ultimate aim of all these schools of yoga is to slow down the speed of the thoughts in the mind. And that is done by using the body, the breath, and the mind directly in the same sequence. You start with the body, then go to breath, and then prepare yourself for meditation. So this is a very common thing, in our practice. It is very easy to go to gym, to tell them to go for a 45-minute walk. American Diabetes Association also says every 30 minutes you do some 5 minutes of, movement, exercises. So why yoga then? Why yoga if exercise can suffice? So what is happening here is that the steadiness aspect of yoga, the mindfulness aspect of yoga, whichever part of the body that is stretched, the mind goes there. The breath coordinates with the body. So the coordination of the body, breath, and mind together in one sync is not happening when you go for a walk. What is happening to the mind? Even if I am walking on a treadmill, I am going for a walk, the mind keeps wandering. That loop, that chitta vritti is not breaking. So it is here that yoga brings back, using the body, using the breath to the present moment first, and then turns inwards. So is there a connection, between body, breath, and mind? Which posture would a person adopt, when he is very sad? Which kind of posture would a person adopt naturally, subconsciously, when he is very happy? Any comments? Sadness, what it does to the body? There is flexion. There is drooping of the shoulder. Everything goes down. But happiness opens. The head opens up, chest opens up. So a person who is sad, a person who is happy, there is a particular change in the body posture with the emotions. Now, will it work the reverse way? If a person is depressed and if I tell him, do hands in and out breathing. Breathe in, gentle smile on the face, breathe out. Now this is the breathing of happiness. It gives a feedback to the brain that my mood is changing, I am becoming positive. As simple as this. So all our yoga modules here focus on the backward bend, opening of the chest, especially in chronic diabetes where depression is a common comorbidity. Similarly, breathing patterns are associated with different kind of emotions. Researchers have now clearly demonstrated that the shallow breathing, which is more thoracic, activates the sympathetic nervous system continuously, and a vicious cycle comes up. The noradrenaline, cortisol keeps releasing. Just take a pause and observe, how are you breathing? Is your breath more shallow or more deep? Is it more abdominal or more thoracic? So what kind of, breathing brings a state of parasympathetic dominance instantly? It is very simple. You have to shift it from thoracic to abdominal and reduce the rate to less than 6 per minute. And inhalation is to exhalation ratio of 1:2. Just do it for 15 breaths and you are bringing a shift in your nervous system. So we all know how important it is to bring vagal dominance for the function of the endocrine system. So there are different beautifully designed pranayama techniques. They all come from US now. So it is very disheartening. They take this kind of breathing technique and call it as cardiac coherent breathing, and there is no mention of Patanjali, no mention of Hatha Yoga Pradipika, and then they patent it and they say that this is the breathing that we have developed for anxiety and for reducing the blood pressure. So therefore, this kind of passion is there that more research has to be done using our traditional techniques. Now researchers have clearly shown that the right nostril, which was traditionally called as the Surya Nadi Pranayama, if you just sit and breathe in and out from the right, it activates the sympathetic nervous system. If you breathe in and out only from the left, it activates the Chandra Nadi, the parasympathetic nervous system. If you do alternate nostril, it also activates parasympathetic, but lesser than the left nostril breathing. So there is a clinical application of these kind of breathing techniques. Now researchers have clearly shown that there are receptors at the internal nasal meatus which are connected to the hypothalamus and thereby to the autonomic nervous system. Researchers have also shown that if you breathe in through the mouth, it does not have that impact that you breathe in through the nose. So through the olfactory bulb also there are connections to the different brain networks now. So this I was talking about, that the slow paced breathing, less than 6 per minute, and prolongation of the exhalation. So here we see that the pain threshold goes up. People can tolerate pain better. Also, it is the locus coeruleus activity in terms of pupillary dilatation has been shown that if you exhale longer, then you can reduce the sympathetic activity. On the other hand, there are faster cyclical breathing practices as done in Sudarshan Kriya Yoga. You do Bhastrika Pranayama, Sohan, fast hyperventilation breathing. That has been acting like a ECT. In depression, we found that hyperventilation of this Bhastrika Pranayama, it has some unknown mechanism, but suddenly you see that very quickly patient starts reporting improvement in the mood. So fast breathing practices can be utilized to bring, arousal to a patient who is very fatigued, dull, drowsy, whereas the slow-paced breathing can be used to bring calmness to the sympathetic nervous system. So this is what I was talking about. Another mechanism through which it works is by enhancing the interoceptive awareness. And there is a definite effect of slow-paced breathing on emotion regulation as well. This is a study, this was my MD thesis, where, I used patients with schizophrenia and healthy controls and asked them to do a particular breathing technique, very popular technique called Kapalabhati. It involves flapping movement of the abdomen. So I was wondering why sages called a breathing that involves flapping of the abdomen as Kapala Bhati, forehead shining breath. So therefore use this FNIRS device. It is called as poor man's MRI, because you just keep a belt here and it can take up the oxy and deoxyhemoglobin changes in the prefrontal cortex. So it allows that flexibility of doing various yoga things and still, able to get some data. So observe that during this breathing, performed at a rate of 90 to 120 per minute, there was oxygenation in bilateral prefrontal cortices. So probably, sages understood something, that the flapping of the abdomen is doing something to my forehead, something to my brain, and that bhati was actually oxygenation of PFCs. So this I observed in healthy controls, and it was not observed in the schizophrenia patients. Similarly, another study that we did at NIMHANS, where people under the MRI scanner chanted Om. O and Ma in the ratio 1:2. It was predominantly the humming component. That actually stimulated the auricular branch of the vagus and brought a deactivation of the limbic system. So this study was replicated again on a higher sample size, and it was observed that by chanting Om 10 times, you bring limbic deactivation. And we know that limbic area is associated with a lot of, negative ruminations and the emotional imbalances. So here our sages, they talk about, Patanjali Yoga Sutra says, Tataha pratyak chetanadhigamo. You can overcome the obstacles by turning the consciousness inwards. So this is written 2000 years ago in Patanjali Yoga Sutra, and very much applicable right now. From the practice of turning the consciousness inward, you can overcome the obstacles of whatever emotions, agitations of the mind. So therefore, we actually used these three components of Om, A, U and Ma separately, because another yogic text called Mandukya Upanishad says that the state of wakefulness comes with the sound A, the state of dream comes with the sound U, and the state of deep sleep comes with the sound Ma. So we wondered, it is considered as the gem among all the Upanishads. It has only 12 sutras, and if you put in Google, it will not take more than 5 minutes to read it. But it is considered as the topmost Vedic literature, Mandukya Upanishad, telling that the human consciousness has 4 legs: wakeful, dream, sleep, and transcendental. A is wakeful, U is dream, Ma is sleep, and the silence between the Om is the transcendental Turiya Sthiti. And it says that it is this Turiya Sthiti that gives us mastery over wakefulness, dream and sleep. So the application here is, every personality is different. Some people are more drawn towards wakefulness, and these people are called as Rajasic personality, A-dominant personality. Some are more thinkers than doers. They are called as the U-dominant personalities. Then the third are the people you find it difficult to take initiative, who are socially withdrawn. They are Ma-dominant personalities, sleep attached. So people with A dominance are more prone towards anxiety, whereas people with Ma dominance are more prone towards depression. So in this way, these sounds have been utilized clinically by us, and when we put them under the scanner, we actually found that with the sound A, there was involvement of more attentional networks, whereas with the sound Ma, the default mode network shows the higher activation. So there is some biological basis, to these sutras, and there is some clinical application of these sounds and mantras. So some sounds can make you extrovert, some can draw you in. So the Ma sound, if somebody is not getting sleep, I would advise do gentle humming, because it naturally withdraws, cuts you off and takes you inside. Ma sound we subconsciously also use when we go inward. Say, all of you may be hungry now, and you get your favorite dish, say pastry, a chocolate pastry, and you just put it. When you are very hungry, you say, So part is something that I am turning in and I am enjoying it. Whereas, when I have to lift a very heavy weight, my consciousness moves out. Is the sound you naturally put in whenever ouch sound goes, when the consciousness moves outward. So therefore, we use these particular sound techniques to balance the consciousness. So therefore, you can use the activating areas of the brain, the stopping areas of the brain, by using certain breathing techniques, certain sound resonance technique, and certain bodily postures. So this is the introduction I wanted to give you about how the mind-body techniques are designed. So now coming to the scientific literature, you see, first RCT of yoga was on biofeedback, hypertension, compared it in 1975. After that, it was very sparse. But then, from 2000 onwards, you see an exponential rise, in the number of RCTs. This is only RCTs that have been done. India definitely is leading, but then many Western countries, especially US, is contributing the major chunk in the yoga research, followed by UK, Australia, Germany, Canada. And these are the areas where maximum number of RCTs have been done. So, people thought that yoga is only for prevention, but then, especially in stage 4 breast cancer patients, lot of quality of life improvement, rehabilitative measures, reduction in the side effect of chemotherapy medication was found. Then we see asthma, and then the depression and diabetes, then of course low back pain. So these are major areas where this has been tested and applied. Now coming to the yoga and type 2 diabetes per se, 27 randomized control trials, 13 meta-analysis. And what does it conclude? Number one, it can enhance muscle strength and cardiorespiratory fitness. That is all known. But clinically, there is reduction in HbA1c as well as fasting blood glucose. And what is the extent of reduction? The mean reduction in all these trials, it is a recent 2022 meta-analysis, says that on an average, 12 weeks of yoga intervention is average in all the studies. So there are studies beyond that, lesser than that. 0.84% reduction 12 weeks of yoga intervention can bring as an add-on effect to the modern medication. And this meta-analysis also concluded that every additional day of yoga practice per week added a differential advantage of 0.22% reduction. So there was a dose-response kind of a relationship. So now quickly, going through major RCTs that have been done, this Nagratna et al., I was also involved here, 9-month yoga study follow-up where there was a comparable exercise program and the therapist and client interaction were matched. Physical activity calorie levels were matched. And still it was observed that the control was better in the yoga group, therefore there was a greater reduction in the hypoglycemic agents and HDL levels were better. Similarly, not only in India, there are studies done in US, there are studies done in Australia where it has been observed that BMI reduced, weight circumference, these are between group results which I am putting. The third study, it was observed that both the groups showed reduction in FBS levels but lesser than the control group which just followed usual routine. This another study, it was observed that HbA1c levels reduced from 7.05 to 6.86 in 12 weeks in the yoga group, but it was to a lesser extent in the control group. Vaishali et al., when they did the trial, they found in elderly, type 2 diabetes patients, 6 weeks of yogasana and significant improvement in HbA1c lipid profile as compared to control. Kher et al. Showed, in this study, in US and in Western countries, if you see the intervention is usually given on the weekends, whereas in India, the common pattern is 5 days per week. So here people want to do it more regularly. And insulin requirement was lesser in the yoga group. So these were all poorly controlled patients. So insulin requirement was lesser in yoga as compared to exercise group. Similarly, in this study, we find that Hatha yoga practice for 2 hours, once a week for 24 weeks. So HbA1c, albuminuria and these factors reduced, and clinically the hypoglycemia and hyperglycemia episodes were also lesser. So there is something in yoga which is called as samatvam yoga uchyate. So yoga, even with blood pressure studies, we see that sometimes result doesn't come significant, but when we properly look at the data, it is observed that those with high blood pressure, their blood pressure comes down, whereas those who have low blood pressure, their blood pressure goes up. So there is something in the practice of yoga that it brings you towards homeostasis. It is not unidirectional. This is the trial that we did. Unfortunately, the COVID-19 pandemic happened between the trial. So 160 patients randomly divided into 2 groups, yoga and physical exercise group. And what we did was in the first month, we gave them 20 supervised sessions in our yoga center. We collaborated with Dr. Govind's Diabetology Clinic and Sagar Hospital for this. And what we observed is that these 2 groups, we followed them up for 1 year. First 20 sessions were given in a supervised way. After that, they were asked to join us through telemode. And we conducted live sessions every day morning for both the groups for continuously, for 6 months. And after that, shared a video with them and asked them to, the tele-yoga sessions were continued for 11 months, 45 minutes per day. But after the 20 sessions, we shared a video where whenever they cannot join our live session, they would do using the video. And of course, it was a COVID-19 pandemic and we had more than 50% people who dropped out, at the end of 12 months. So started with 80, but we ended up with 28 and 23 in each arm. And the yoga intervention that was given was a yoga for diabetes module that has been developed by the Ministry of AYUSH. So we would start by hand stretch breathing, then we would go with the practice of forward, backward bending, twisting, Sarvanga Pushti, that is the rotation, then 10 steps Surya Namaskara. After that, they would perform the twisting in the lying down position, Shashankasana, then the Pavan Muktasana, wind releasing pose, Viprit Karni where the legs are up, then Bhujangasana, then Dhanurasana, then Mandukasana. These are specific asanas which yoga experts recommend for diabetes. Then lying down and then performing flapping of the abdomen, that is Agnisara Kriya, Nadi Shuddhi and Brahmari, and then of course the Auma chant. So this was a complete module that was of a duration of 45 minutes. And the control group was given exercises, which were matched with the yoga group, and we continued it. And this is how the tele sessions were continued. And what we observed was that the HbA1c levels, from 8.10 came down to 7.30 in the yoga group at the end of 6 months, and then to 6.40 at the end of 12 months. So mind you, it was a time where people were highly stressed and there was very less physical activity. So these sessions were giving them that. But with the exercise, we observed that after the 6 months, there was an increase. One of the reasons, that we could think of is that people found doing tele-exercise boring. Yoga had so many, practices like breathing practices, relaxation technique, chanting, but just doing exercise, same exercise every day on a tele mode was not very much, interesting for the patients. In the same way, though we found that the BMI and the waist hip ratio reduced in both the groups, but there was an advantage. Now looking at the scientific mechanism, two approaches are there. One is the top down and the second is bottom up. In the bottom up approaches, it is mainly, you flap the abdomen, you do all these breathing techniques. It is the vagal efferents which are getting stimulated. Whereas the top down, we see that it is mainly the control over the autonomic nervous system, parasympathetic dominance, and number of studies, 3-4 studies have now shown that yoga practice can enhance GABA levels. So centrally, it is the enhanced GABAergic tone which is reducing the anxiety. Yoga has been found to be as safe as usual care and exercise. Yoga is cost effective. You do not require any equipment. It can be delivered in groups as compared to, other mind-body interventions like CBT. And it is simple and easy to teach. And people feel more connected and people feel empowered that they are doing something for their own health. So this is the slide which I always put in my presentation, because being a modern medicine doctor, I believe in integration. So this is the Brazil team. The people who are bending, are center forward. People standing behind are the defense. So the center forward is modern medicine and the defense is mind-body medicine, and they have to come together to win the match. So these are the slides where the patients are undergoing yoga sessions here at NIMHANS. We are continuing these tele-yoga sessions during the whole pandemic. We continued this, and people asked that we should continue that even if the pandemic is over, and this is 2 years now that every day these sessions are going on, and all of you are welcome. These are sessions for stress reduction and well-being. We conduct them from 6:50 a.m. to 7:30 a.m. and you just have to put this Zoom ID and this passcode, and there is no registration required. And we have, taught these many people. This is a recent textbook that we have published. It is available on Amazon that describes all the principles and especially focusing on mental and neurological health care. So in collaboration with Indian Psychiatric Society. So in future, we have to focus on the preventive aspect of diabetes. We have to understand the mechanisms of mind-body medicine more deeper and develop tools that can catch. All our tools follow linear model, but the effects that these techniques produce are so subtle that you need tools that have quantum mechanics, to assess. And other unexplored area, definitely we need more long-term follow-up studies. So yoga is scientific mind-body practice with strong philosophical basis. It can help enhance the wellness component in the patient and adopts a multidimensional approach in the multifactorial problem of T2DM, and therefore can serve as a very useful adjuvant in clinical practice. Thank you. Thank you very much.
Probably one of the best ever lectures that I have listened to in the last 25 years related to the science behind yoga. A huge applause to you, Doc. We know that it is ancient, it works, but you've shown us how it works and what's the science behind it. You've taken us through the modern viewpoint of this, which is definitely what we as modern practitioners need to know on how it can be integrated into our mainstream practice. And I hope and wish we are able to pass on these benefits to more and more number of patients to get the maximum benefits. Hats off to all your contributions.
Thank you. So we have a big team of yoga therapists which have been trained, in Swami Vivekananda Institute in Bangalore. There are a lot of MSc, PhD yoga that have passed out. Now is the time, clinicians like you start hiring them. If you need yoga therapists, please mail me. I will instantly connect you to a person in your own area. Okay. Thank you. Thank you.
That was a wonderful session, Dr. Hemant. I just have one small bit to add upon this. As we went through a very enlightenment session now, and very rightly you compared the mind, and mind as known is, it's, though we have evolved from monkeys, we still have monkeys in our mind. So that's how the monkey jumps from one aspect of one subject to other one, very well defined. I just have one question to ask you, sir. Now, you mentioned about the westernized yoga, like we have bear yoga, we have doga where they do with the dogs. People who do in snow, they call it a snoga. So what is your take on this?
So this, really, it brings a lot of pain, because when I read Patanjali's Yoga Sutra and see their vision, and see that a beautiful, wonderful science of yoga also gets distorted, so it is very disheartening. So therefore, the approach in all our researches is, another important point is branding. We see that in medicine, we encourage generic practice. So therefore, in all our studies, we reveal the components of yoga. We reveal what dose was there, which practice was there, for how many rounds it was there. So therefore, in fact, we have written a paper on this in the International Journal of Yoga and Physical Therapy, where we said that in yoga, the generic component should be promoted, because when ancient sages taught it to their students, they were just open to whoever who wanted to learn them. So, yeah, thank you.
Thank you, Dr. Hemant. Well, everyone knows me, how restless I get when time is not maintained. But I was the first one to go and told them to switch off the timer. I think this is I have done for the first time in my life. And I second what my friend Dr. Pradeep told. It was a fantastic session. And wherever I have been made to write the scientific session, we'll definitely work together on that. And I was always thinking yoga is the way forward. He showed us that yoga is the way inward, actually. Thank you so much for that.